Hey guys, it's me Sujoy over here. So I'm back with another video. Today I'm going to be talking about the alarming rise of mental health disorders in Vietnam. So I just went through an article yesterday from Vietnam News, which is my go-to guide for keeping myself updated with the latest news happenings over here in Vietnam. And when I actually read that article, I was a bit shocked. But this is something which I can definitely relate to, and it's been going on for a long time now, for many years. But it's not people don't openly talk about it, and like the stigma which has been attached to it. So let me just give you a quick overview as to what are the kinds of mental health disorders which we're seeing out here in Vietnam. Primarily depression, anxiety, and also people suffering from PTSD. Um, so depression definitely I can relate to, and anxiety as well. I mean, let me just be very clear over here that it's not only for Vietnam, but also, from where I come from India, there's a high level of, depression rate back home. And of course, if in Japan as well, I mean, the suicide rate in Japan is quite high. But it's something which is actually impacting globally. But here, I guess, it's kind of in an alarming rate here in Vietnam, because like 14 million people here in Vietnam are actually suffering from mental disorders. And I mean, this is nothing new. I mean, of course, I used to teach English in schools for many years here in Vietnam. I mean, I'm a professional teacher, but I knew that some of the students, whom I would interact with, they had some challenges in their life. And of course, like when you're young, when you're growing up, and if you have abusive parents, or if you're constantly witnessing domestic violence, or your parents are separated, that definitely impacts a child's mental upbringing, in the long run. Isolation, anxiety, the environment where you are. So definitely, mental health is a big issue over here. I'm going to read that article. And this is predominantly happening in low to middle income countries, although I don't completely agree with that. But it also, like, if you look at Japan, like the suicide rate in Japan is quite high. Even in China, there's a lot of stress and depression, because like the students over there, they have too much pressure in their schools. They have to outperform, they have to get good grades and all that. So definitely all this leads to a lot of anxiety, depression. um, and also the sad part is that, you know some people who are suffering from mental health, they're trying to ease the pain by having illegal, some of them, like, I'm not saying, like maybe in Saigon or in Hanoi, crackdown of there should be like a crackdown of illegal drugs and substances being sold to certain patients, who are suffering from mental health disorders, anxiety and depression. Because consuming illegal substances is not going to solve your mental health issues. It's very temporary form of easing the pain. But like I said, there should be a crackdown for illegal substances being sold, illegally distributed here in Saigon and in Hanoi. And and of course, like if you go to these clubs and all that, you see people consuming the balloon and all that. How do we know, like, what kind of gases are we consuming in our body? I mean, is that going to impact our mental health? So there should be kind of a check on this. I mean, um, Of course, there should be like screening tools. So I'm going to just quickly read out the article, and then I'm going to provide some solutions which I feel could be implemented. But like I said, these are just my personal opinions. So I'm just going to read this article out from Vietnam News, and I'm going to keep a link down in the description below for you to also read the article. So the article states 14 million people suffer from mental disorders in Vietnam. About 14 million people suffer from mental disorders in Vietnam, but the country has only 143 clinical psychologists and psychotherapists. So that's a very small number of clinics, psychologists, I mean clinics when it comes to catering for mental health patients, for patients who are suffering from mental disorders. Uh, so about 14 million people suffer from mental health disorders in Vietnam. So like I said, moreover, clinical psychology services are not officially covered by health insurance. This was the message delivered at a conference on strengthening the capacity of mental health care system in the period of 2023 to 2030, which was organized last Thursday by the Department of Medical Service Administration. Um, I'm just going to take out the important points from the article because I don't want to get too much into detail. So, Vietnam is feeling impacts due to gradually aging population and a high proportion of people with neutral disabilities, as well as consequences of COVID-19 pandemic. So, yeah, the COVID-19 pandemic, the lockdown, like Vietnam was having a lockdown for so many months. I mean, definitely Vietnam did a great job for combating COVID-19, but like if being locked down for several months or even for a year, definitely impacts, no social life, disconnection from the society. So all this leads to a rise in anxiety, depression, mental health. I mean, if I can be honest with you, like when I was confined at home during the COVID-19 pandemic, for years as a lockdown, I psychologically started adapting this to myself that no, I just rather be at home. I don't want to go out anywhere. I don't want to connect with people, and definitely a rising anxiety, depression. I feel scared to interact with the society. Yeah, so all of this definitely has impacted, when it comes to mental health disorder. So, however, only 9.1% equivalent to 59 out of 649 of district level hospitals organize inpatient medical examinations and treatments for mentally ill patients. Mental health services in Vietnam are mainly drug treatments, so mental rehabilitation services are very limited, and there are no formal mental health services for people affected by natural disasters such as floods, droughts, and epidemics, including the COVID-19 pandemic. Um, the suicide rate in 2015 in Vietnam was 5.87%, was 5.87 per 100,000 people. So the Ho Chi Minh City Pediatric Hospital said that 8 to 20% of Vietnamese children and adolescents have common mental health problem, which is not quite surprising. So, yeah, I mean, just have a go through the article. I don't want to talk too much into detail about this. Um, so, yeah, so a couple of solutions. I'm going to keep a link down in the description below for you to check this article out. Definitely, there should be screening tools, more implementation of rehab centers around Saigon and even in Hanoi. And what it really pisses me off is that there's this huge lack of awareness, when it comes to mental health disorders, because people in this predominantly nation countries, like they say, oh, if somebody wants to talk about, like, I'm going through depression, anxiety, And if they want to consult with their parents or talk to their friends, they just say, get over it. This is just you don't have, nothing is wrong with you. Like nothing is wrong with you. I think that's a very wrong way to go about it, and that eventually leads to a lot of problems in the long run, and may lead to the person committing suicide. So definitely people should have more awareness. You should talk about it. People should provide a lot of empathy, more awareness, because this is a serious issue. Lack of awareness, mental health ignored. People shrug it off. Like, oh, nothing is wrong with you, everything is okay, my child is okay, but he or she just behaves like this sometimes. Well, in fact, I feel that schools, corporations here in Vietnam, factory workers and all that, they should have some kind of a a recreational center, or like welfare, or like talk about it, like where they can talk about their mental health issues. People, employers, they should be open to hear about this, instead of just saying, oh, okay, you think you're not okay, then you should not teach in the school and all that stuff. So we are all humans, we all have problems, we're not robots. So of course there should be like a huge campaign drive here in Vietnam for tackling the mental health issue. Like there should be more recreational centers, like the laughing clubs. I don't know if it's out here in Vietnam or not, but like in India, there are many parks where people, they just gather, and together, and they laugh a lot. Because that emotionally releases a lot of stress and anxiety. So like laughing clubs in the park. Like maybe do some tai chi or whatever it is, like more yeah, so like socializing clubs, like where people can come together in a group, talk about their problems, their like their challenges in life. What kind of, are they going through anxiety, depression, PTSD. So there should be more like social clubs, and these should be organized by the companies, schools, even factory workers. There should be certain, departments in these institutions, or in these companies and all, where they can, where employees can freely go up to, and talk about it. And so instead of administrating drugs and all that, the best way to combat about to overcome mental health disorders is to talk about it. People, listening to you, providing empathy, and giving you that love and care which you never had. So the feeling that you're not alone, the feeling that people care about you, that you're not isolated, you're not kept, isolated from the society, or we don't care about you. So that's, people need to care about it. So providing love and care also, um, power of digitalization, can also combat mental health disorders here in Vietnam, because keep on hearing a lot about the digitalization phase out here, the drive out here in Vietnam. So like maybe if there can be certain apps, here, where they can actually evaluate the patient's, mental health progress, or like AI recognition for combating mental health. Certain apps which you can download from Android or from your Apple iOS. So these are certain opportunities which I do see when it comes to power of digitalization, when it comes to, combating, mental health disorders, here in Vietnam. Why only in Vietnam, but also globally? So, finally, I mean, I just want to wrap up saying that, if you're suffering from anxiety, depression, go talk to a doctor. I mean, talk to your family members about this. You're not alone. I've gone through a lot of depression in my life. I have I've lived in Russia for 10 years of my life, where the environment was very challenging and very difficult for me, and I've had gone through a lot of anxiety and depression when I grew up, so yeah, I mean, and also there should be like a suicide prevention centers across the cities here in Vietnam, so that people can go talk about the problems, the challenges, so yeah, a lot needs to be done. Like I said, this is like an alarming news, which people really don't want to talk about it here in Vietnam, but it's actually there, believe it or not. It's pretty much present. So yeah, so I finally, if you are an expat and you're traveling around in Southeast Asia and you want to start a successful online business and you want to make passive income online, then make sure to check out the link down in the description below as well. It's an exclusive access to a free webinar invite, which you can register, and it will explain you the entire business model. So that's all I got to say. If you like watching this video, make sure to like and subscribe to my channel. Stay strong. We love you. You're not alone. We care about you. Let's bring a lot of love and care in this world. You guys, I love you guys a lot. Peace out.